Hi students, in today's video we are going to discuss the remaining part of our fifth chapter, that is physiological parameter. In first part of chapter we are studied pulse rate किंवा heart rate, body temperature, clotting time of blood, blood pressure, hemoglobin count. In this second part, we will continue with next point, that is RBC count, WBC count, then differential leukocyte count, erythrocyte sedimentation rate, blood sugar, blood cholesterol, and sperm count. These we will discuss in today's video. So let's start with RBC count. The RBC म्हणजे काय? Red blood corpuscles. These are the RBC. Normal range काय आहे? तर मेल मध्ये 4.5 to 5.5 millions per cubic millimeter. cu.mm म्हणजे काय? Cubic millimeter. 4.5 to 5.5 millions per cubic millimeter. In female, in that 3.5 to 5.5 million per cubic millimeter. Infant मध्ये, that is newborn child मध्ये किती? तर 4.5 to 5.5 millions per cubic meter. Male RBC count मध्ये नॉर्मल रेंज काय आहे? तर 4.5 to 5.5 millions per cubic millimeter. Female मध्ये, in female 3.5 to 5.5 millions per cubic millimeter. In infant 4.4 to 5.5 millions per cubic millimeter. In that same range 5.5 should be maintained in RBC count. The RBC count significance in that RBC count increases in the following conditions: high altitudes, fasting, sweating, vomiting, diarrhea, polyuria, defective oxygenation in lungs, severe burns, congenital heart diseases. ह्याच्यामध्ये काय होतं? तर RBC काउंट जो आहे तो इन्क्रीज होतो. इन दॅट RBC काउंट इन्क्रीजेस इन द फॉलोइंग कंडिशन्स: हाय अल्टिट्यूड्स, फास्टिंग म्हणजे उपवास, स्वेटिंग, वॉमिटिंग, डायरिया, पॉल्युरिया, डिफेक्टिव्ह ऑक्सिजनेशन इन लंग्स, सिव्हिअर बर्न्स, congenital heart diseases. In these conditions, RBC count increase. The count decrease in all types of anemias and leukemias and after hemorrhage. RBC count जो आहे तो ॲनिमिया मध्ये किंवा ल्युकेमिया मध्ये काय करतो? डिक्रीज होतो. RBC काउंट जो आहे तो, आणि कशामध्ये? आणि हिमोरेज, आफ्टर हिमोरेज RBC count decrease. Normal range काय आहे RBC count? In that 4.5 to 5.5 millions per cubic millimeter in male. In female 3.5 to 5.5 per millions per cubic millimeter. In infant 4 to 5.5 millions per cubic millimeter. In that significance, RBC count increases in the following conditions: in high altitudes, fasting, sweating, vomiting, diarrhea, polyuria, defective oxygenation in lungs, severe burns, congenital heart diseases. In that, RBC count increases. The count decreases in what condition? In that anemia and leukemia, and also after hemorrhage. Then second, it is WBC count. It is total leukocyte count. WBC count, it is total leukocyte count. Normal count काय आहे WBC? In that adults 6,000 to 10,000 per cubic millimeter. In children 8,000 to 10,000 per cubic millimeter. Infant, in that 10,000 to 20,000 per cubic millimeter. These are the count for adults, children and infant. Clinical significance of WBC count, that is leukopenia. Count below 4,000 per cubic millimeter. In that, we will discuss in previous lecture. These are the physiological constant, that is normal count. When these increased or decreased, on this basis diagnosis of disease takes place or evaluation of health status. Therefore, physiological constant of the human body which are determined for the evaluation of health status and for diagnosis of diseases. In that, certain normal count in our WBC count, that is total leukocyte count. Normal count in that adults, children and infant. Adults, that is 6,000 to 10,000 per cubic millimeter. In children 8,000 to 10,000 per cubic millimeter. And in infants 10,000 to 20,000 per cubic millimeter. Clinical significance, in that we will discuss leukopenia, leukocytosis and leukemia. Leukemia, that is blood cancer. In that, leukopenia, it is count below 4,000 per cubic millimeter. Leukopenia, in that WBC count below 4,000 per cubic millimeter. In leukocytosis, its WBC count increases to 11,000 to 20,000 per cubic millimeter. Leukocytosis, in that leukocytosis increases. Leukopenia, in that count below 4,000 per cubic millimeter. In leukocytosis, in that count increases to 11,000 to 20,000 per cubic millimeter. In leukemia, in that blood cancers occur, also called blood cancer, is count beyond 20,000 to 1 lakh per cubic millimeter. In that cancer, that is growth occurred, cell growth, cell count increase होतो, that is cancer मध्ये. In leukemia, that is blood cancer, it is count beyond 20,000 to 1 lakh per cubic millimeter. In leukemia, blood cancer, leukocytosis, in that count increases to 11,000 to 20,000 per cubic millimeter. In leukopenia, that is count below 4,000 per cubic millimeter. In leukocytosis, that is occurs in the leukocytes leukocytosis occurs in the following conditions, in that asthma, high fever and skin diseases. In leukocytosis, that is WBC count increases. At what range? 11,000 to 20,000 per cubic millimeter. In leukocytosis occurs in the following conditions, in that asthma, high fever, skin diseases, appendicitis, tonsillitis, meningitis, convulsions, diabetic coma, uremia, gut lead poisoning, and physiological, in that muscular exercise, fear, increased adrenal cortex cavity, pregnancy, menstruations after a meal, and acute infection by pyogenic cocci. In that leukocytosis in that WBC count increases up to 11,000 to 20,000 per cubic millimeter. In that leukocytosis occurs in various conditions, in that asthma, high fever, skin diseases, appendicitis, tonsillitis, meningitis, convulsions, diabetic coma, uremia, and gut lead poisoning. And in physiological conditions, in that muscular exercise, fear, increased adrenal cortex activity, then next pregnancy, next menstruation, and after a meal, then acute infection by pyogenic cocci. These are the RBC count and WBC count. In RBC count, normal range and significance. Then WBC count, normal count and some clinical significance. In that leukopenia, leukocytosis and leukemia. Leukemia, that is blood cancer. In leukopenia, in that WBC count below 4,000 per cubic millimeter. Leukopenia occurs in the following conditions, in that starvation, fear, anxiety or stress, blood disorders like agranulocytosis, aplastic anemia and lymphatic leukemia. Third, influenza, measles and enteric fever. Then fourth, exposure to UV radiations, and fifth, hepatitis and cirrhosis. These are the some conditions occurs in leukopenia. Leukopenia, that is WBC count below 4,000 per cubic millimeter. In leukopenia occurs in the following conditions, in that starvation, fear, anxiety or stress, then blood disorders like agranulocytosis, aplastic anemia and lymphatic leukemia. Then influenza, measles and enteric fever, then exposure to UV radiations and hepatitis and cirrhosis. In next part, it is differential leukocyte count. This is DLC. These are the also type of WBC and also called as granulocyte. Part of granulocytes. It is differential leukocyte count. In that DLC, the proportion of different types of leukocytes is as follow. The proportion of different types of leukocytes. Leukocytes कोणकोणते आहेत? Neutrophils, eosinophils, basophils, lymphocytes and monocytes. These are the different leukocytes. Neutrophils, eosinophils, basophils, lymphocytes and monocytes. In that neutrophils, it is 60 to 70%. Eosinophils, that is in that 2 to 4%. In basophils, 0 to 2%. Lymphocytes 20 to 30%. Monocytes 5 to 10%. In neutrophils, 60 to 70%. 60 to 70%. Eosinophil 2 to 4%. Basophils 0 to 2%. Lymphocytes 20 to 30%. Monocytes 5 to 10%. These are the normal value of different types of leukocytes. Significance of that, neutrophilia, that is increase of neutrophils. Neutrophilia means increase of neutrophils, that is in neutrophils count increases in neutrophilia. In acute bacterial infections like pneumonia, whooping cough, septicemia and appendicitis. Then next, neutrophils appears in urine of patients with urinary tract infection. Then intoxication or some infections show increase in number of nuclear lobes. These are the neutrophilia, that is increase in neutrophils. In that 60 to 70% neutrophils count, when it increases, that time neutrophilia occurs. In acute bacterial infections like pneumonia, whooping cough, septicemia and appendicitis. Then neutrophils appear in urine of patients with urinary tract infection. Then intoxication or some infections show increase in number of nuclear lobes. Then next, eosinophilia. Eosinophilia also called increase in eosinophils count. That is eosinophils count, normal count, that is 2 to 4%. Neutrophils, that is 60 to 70%. In eosinophils 2 to 4%. In that eosinophilia, that is increase in eosinophils count. It indicates the allergic conditions and presence of intestinal parasites. It indicates the allergic condition. काय करतं? It indicates the allergic condition and presence of intestinal parasites. In asthma of the bronchial type, renal or cardiac, the count increases. In asthma of the bronchial type, renal or cardiac, the count increases. It also observed in many skin diseases. Eosinopenia, that is decrease of eosinophils, then count below 2 to 4%, occurs in injuries, burns or release of adrenocortical hormones and in acute pyogenic infections. In that, it indicates the allergic condition and presence of intestinal parasites. It indicates the allergic conditions and presence of intestinal parasites. In asthma of the bronchial type, renal or cardiac, the count increases. It is also observed in many skin diseases. In that, eosinopenia, it is decrease of eosinophils, occurs in injuries or release of adrenocortical hormones in acute pyogenic infections. These are the eosinophilia. It is increase in eosinophil, that is count increased 2 to 4%, about 2 to 4%. And in eosinopenia, in that count decreases from 2 to 4%. In basophilia occurs in granulocytic leukemia. Basophilia occurs in granulocytic leukemia. In that, basophils, that is, these are the WBC from the bone marrow that play a role in keeping the immune system functioning correctly. From the bone marrow that role in keeping the immune system functions correctly. Basophil helps to diagnose certain health problems. When low level of basophil, sign allergic conditions. When basophil level is low, at that time allergic reactions occurred or allergic conditions occurred. Basophil level helps to diagnosis certain health problems. Normal count basophils, that is 0 to 2%. Then lymphocytosis. In lymphocytosis, in lymphocytes, the count is 20 to 30%. 20 to 30%. In that lymphocytosis, that is increase of lymphocytes. Increase of lymphocytes about 20 to 30%. Acute infections like measles, mumps, influenza, patients with chronic lymphatic leukemia, tuberculosis and whooping cough show extremely high counts. Conditions like enteric fever and diabetes also show higher count. There is lymphocytosis, in that increase of lymphocytes. Acute infections like measles, mumps, influenza, patients with chronic lymphatic leukemia, tuberculosis and whooping cough show extremely high counts. Conditions like enteric fever and diabetes also show higher count. These are the some factors when acute infections occurred from lymphocytosis, that is increase of lymphocytes about 20 to 30%. Then next आहे monocytosis, in that increase of monocytes. Bacterial infections like tuberculosis, bacterial endocarditis, then protozoal infections, that is malaria, monocytic leukemia and Hodgkin's diseases. These are the monocytosis. Monocytes, that is increase of monocytes, that is above 5 to 10%, that is monocytosis. That is increase in monocyte count, that is 5 to 10%. Above 5 to 10%, there is monocytosis. In that bacterial infections like tuberculosis and bacterial endocarditis. Then next, protozoal infections, in that malaria, monocytic leukemia and Hodgkin's diseases. नेक्स्ट पार्ट आपण बघायचा आहे इरिथ्रोसाइट सिडमेंटेशन रेट. इन दॅट ESR. ESR means erythrocyte sedimentation rate. ESR is defined as millimeter of clear plasma formed at the top of the vertical column in 1 hour. ESR value. ESR म्हणजे काय तर erythrocyte sedimentation rate. ESR is defined as millimeter of clear plasma. क्लिअर प्लाझ्मा जो आहे ॲट द टॉप ऑफ द व्हर्टिकल कॉलम. व्हर्टिकल कॉलममध्ये ॲट द टॉप पोझिशनला जो क्लिअर प्लाझ्मा तयार होतो तो म्हणजे काय आहे, व्हर्टिकल कॉलम इन 1 hour. दॅट्स कॉल्ड इरिथ्रोसाइट सेडिमेंटेशन रेट इन 1 hour. इन 1 hour. Normal value, it is measured in millimeter per hour. In that millimeter of clear plasma form at the top of the vertical column. In what time? That is in 1 hour. So ESR value is measured in mm, that is millimeter per hour. Then method, in that Western and Winthrop. There are two methods. In that ESR value according to male and female that are different. In that Western method and Winthrop method. In male that is 3 to 5 millimeter per hour and female in that 4 to 7 millimeter per hour. In Winthrop method, that is in male 0 to 9 millimeter per hour and in female it is 2 to 20 millimeter per hour. in significance in that ESR, that is erythrocyte sedimentation rate. Determination determination is of great importance in the diagnosis of disease like tuberculosis and rheumatoid arthritis, in which it increases. ESR value जी आहे, in that it increases in the tuberculosis and rheumatoid arthritis. So it is of great importance in the diagnosis of disease like tuberculosis and rheumatoid arthritis, in which it increases the ESR value. The ESR also increases in anemia, jaundice and septicemia. The ESR decreases in allergic condition. ESR decreases in allergic conditions. Next point, that is blood sugar. Normal value in that fasting blood sugar is 80 to 120 mg per 100 ml. Fasting sugar in that first sugar. After in that blood sugar, normal value, fasting blood sugar in that 80 to 120 milligram per 100 ml. Increase in blood sugar is known as hyperglycemia and decrease in blood sugar is known as hypoglycemia. In that fasting blood sugar means early morning blood should be taken from patient. These are the fasting blood sugar. After overnight, in that patient should not take any food. In that this is fasting blood sugar is 80 to 120 mg per 100 ml, and increase in blood sugar is known as hyperglycemia and decrease in blood sugar is known as hypoglycemia. In that significance, blood sugar level rarely exceeds 200 mg% except in diabetes. Blood sugar level rarely exceeds 200 milligram% except in diabetes. Hypoglycemia may be the result of insulin overdose or pancreatic tumor or alcohol intake. In that hypoglycemia seen. Hypoglycemia may be result of insulin overdose or pancreatic tumor or alcohol intake. These are the blood sugar. Then blood cholesterol. In that normal value of blood cholesterol in blood cholesterol, normal value of blood cholesterol in that 115 to 250 milligram%. As age increases, the blood cholesterol increases and it may rise up to 300 milligram%. Cholesterol in the blood is present as free cholesterol 30% of total cholesterol, that is 20 to 40%, that is free cholesterol, and ester cholesterol, that is 70% of total cholesterol, that is 60 to 80%. In that free cholesterol and ester cholesterol present in cholesterol in the blood is present as free cholesterol 30% and ester cholesterol 70%. In normal value of blood cholesterol, that is 115 to 250 milligram%, and as age increases, the blood cholesterol increases and it may rise up to 300 milligram%. Then significance of the blood cholesterol in that total cholesterol level mg%, in that 300 to 400 milligram%, that is disease occurred, that is coronary thrombosis. Then 400 to 500 diabetes. Then 500 to 700 obstructive jaundice. Then 600 to 700, that is nephrosis. Then 80 to 100, that is hyperthyroidism and pernicious anemia. These are the total, that is normal count of blood cholesterol in In this, we will diagnose the diseases. In that, 300 to 400 coronary thrombosis, then 400 to 500 diabetes, then 500 to 700 obstructive jaundice, then 600 to 700 nephrosis, and 800 to 80 to 100, that is hyperthyroidism and pernicious anemia. Percentage of ester cholesterol decreases in diabetes, nephrosis, jaundice and myxedema. That is, percentage of ester cholesterol decreases. Then next one is sperm count. That is normal value 50 to 150 millions per cc. In that, normal value 50 to 100 millions per cc. Then significance in that, useful for detecting the productivity. That is, persons with less sperm count may show infertility. Sperm count in that, normal count 50 to 150 millions per cc. In that, useful for detecting the productivity, and persons with less sperm count may show infertility. These are the value we will discuss in today. In that, RBC, WBC count, then differential leukocyte count, then erythrocyte sedimentation rate, blood sugar, blood cholesterol and sperm counts. So, in this lecture, we will discuss these points. So, thank you.